Welcome back to Press Here. The University of California system has quietly built a massive centralized database of patient records from across its campuses they call the warehouse. And scientists say it could be a game changer for medical research, especially in areas like cancer. Joining me now is Dr. Raphael Cuomo from the University of San Diego, UC San Diego, rather, who's been exploring the power and potential of this vast data set. Raphael, good morning. Let me start with the basics. What exactly is the warehouse and how do you use it?
Oh, yes. The University of California Health Data Warehouse is a massive repository of roughly 10 million patient records for roughly 10 million patients across the 6 major health centers of the University of California. And it allows us to get very large samples of patients to do a lot of different kind of nuanced analysis. And I published in many different areas using the UC Health Data Warehouse a number of groundbreaking studies that would not be possible without the large repository that is available to us from the University of California.
So, as I remember from my statistics class, the more samples you have, the more accurate and more trustworthy the results.
Absolutely. It's about a set of patients that's generalizable to the broader public, right? If we have only a few patients, we're not going to be able to deduce much from that would be applicable outside of just those few patients. But if we have 10,000 patients or 1,000 patients, as in the recent study that I did looking at cannabis use disorder and colon cancer, then we're able to get a sample that's more generalizable to the broader population of people with, in this case, cancer.
This may be a way of trying to address cancer with a data set this big.
Yes, indeed. I think that there are a lot of, so I'm an expert on the health behaviors and policies that influence cancer, both the development of cancer and also outcomes for patients that have cancer. And it's an incredibly useful data set. I can take patients that don't have cancer and see whether those with a particular risk factor are more likely to develop cancer compared to those that don't have the risk factor. And I can do the same thing for patients with cancer. I can look at different combinations of therapies, different combinations of diagnostic techniques and procedures, as well as their patient history, to see what combination among them is least likely to result in death.
Now, you're using a programming language called R to interact with this data. I mean, this is Silicon Valley, so we're always interested in that. But for people who have never coded, what is R and why is it useful in medical research?
R is an imperative programming language, a lot like Python. It's useful because you can write programs that describe that take your data and do very specific things with it for analytical purposes. So you can, reformat the data and look at it in a lot of different angles. You can compute a lot of different statistics, and that's not something possible in lots of other languages. The database is also something that you would use with a SQL programming language, which is necessary in order to obtain very specific data sets that have the very specific criteria you want, which is critical and essential if you want to answer very specific questions about how to address things like cancer mortality in broader patient populations.
Now, it's an obvious question, but I mean, I know how good you guys are at doctors. I mean, at protecting patient privacy, but somebody might say a database of what now? My stuff? This is, I assume, anonymized.
Yes, indeed. It's a very reasonable concern that patients have, and we have taken many big steps in order to ensure that patient data is anonymized. There is absolutely no way, no trickery of mathematics or code that I could do in order to try to figure out who is who. So there are very strict protections that would not allow us to do that. That being said, we do have lots of different variables available for the different patients, what they've been through, what their outcomes were. So we can answer so many important questions in medical science without even knowing who specifically these patients are.
And those variables are very important because I know I've read that, for many years, science or medicine, rather, was based on, middle-aged white male, and it wasn't applicable. But now you've got patients of every shape, size, race, color, national origin, et cetera, all contributing to this database.
Absolutely. In a recent study that I did, published last year, I found different rates of alcoholic cirrhosis among patients that have of Hispanic ethnicity compared to those without. And I would not be able to do that if I did not have sufficient sample size among patients with chronic alcohol use for those with and in each ethnic group, and those that did not have alcoholism in each ethnic group as well. So we are able to look very granularly at the different race ethnicity groups, and also to compare those with and without a combination of risk factors in each of those groups. And that enables us to answer so many questions about what different groups of Americans are facing, and whether or not any particular groups are more disadvantaged than others, and if so, what kind of steps we might be able to take to prevent poor outcomes among those groups.
And then lastly, big picture, how close are we to seeing this kind of research lead to direct better treatments or discoveries, or have you already?
I think that this is in the early stages. I think that a lot of the research that we have going on right now with regard to better treatments and better discoveries are very focused on clinical trials, right? We randomize patients to one group versus another and see if an outcome differs between one group with a new experimental treatment versus those on a placebo or a standard of care. But AI will allow us to do more complicated things, will allow us to engage in more complicated kinds of trials and more complicated kinds of epidemiological studies that will generate new hypotheses that will take us down whole new avenues. So I have great hope in the potential for AI to help us ask questions we weren't thinking about previously, and also do new forms of analyses we weren't previously comfortable doing without AI.
Oh, it's fantastic. It's really interesting stuff. Raphael, I appreciate you joining us this morning. Dr. Raphael Cuomo, thanks for joining us this morning. And Press Here will be back in just a minute.